The Enigma of Stigma, Shattering Barriers and Fostering Nurse Communication About Cannabis in Clinical Practice and Beyond. This is a picture of Mary and Nick Russo, my parents, and myself, of course, too. My mother was diagnosed with Parkinson's disease at about age 70. And as time went on, she was needing more and more support, as well as my father, to remain independent. And we did what we could to keep them in their home. We provided resources and respite, and we cleaned the house and took over finances and helped with showers and did laundry and did everything we could to keep them there. But then about 10 years after mom's diagnosis, they both could not remain independent. And I moved both of them into my house to care for them. And this was the hardest nursing I've ever done in my life. I had to quit my job and stay home 24/7. And my home became a long-term care facility. But I have no regrets at all. It was such a blessing to be able to care for them both. They're beautiful, wonderful people, in love to the end. I'm the oldest of their 9 children. And Dad passed about 2 years after they moved in, and Mom stayed with me for another 2 to 3 years. And during that time is when I began to learn about medical cannabis, right after Dad passed. And Mom with Parkinson's and me just starting to learn about cannabis, and you hear all these things. I was wondering, well, I wonder if cannabis could help my mom with her Parkinson's. And so I went to all their doctor appointments with them, but I went to the neurologist with my mother one day, and I asked them, a university-based healthcare system neurologist, what about cannabis? And he said, it's hogwash. Okay. So there was another appointment in the future, and this time we were seeing the nurse practitioner, and I thought, well, what about cannabis for Parkinson's for my mom? And she said, I just don't know. And okay, so then we went on further down the road, and I was learning more, but not enough yet. But I asked another neurologist, well, what about cannabis? And he said, I don't know anything about it. But I think he did know about it, because I knew that he had just told us he was going on a skiing trip to Colorado. And I'm thinking, everyone seemed so afraid to talk about it. There was so much fear prevailing in the system, and no one wanted to say anything. So when Mom started on home hospice, I considered asking the hospice nurse about cannabis. And I just kind of felt like I was putting myself in a bad position to do that. I was concerned that maybe she would think something bad of me, or she would take away the hospice, or write me up, or I would lose my license, or we would lose, Mom would lose her services, or something bad would happen. And so I recognized that I had all this fear within me, and I knew about cannabis at this point. I knew a little bit more. I had been studying it, but fear continued to prevail in this topic in healthcare. My name is Marilyn Pierce, and today I want to talk about the enigma of the stigma of cannabis. So let's talk about what those words mean first. Enigma. Enigma is something that is hard to understand or explain. It's like a mystery. And stigma is beliefs or a set of negative understandings that a society or a culture or a group of people all have in common. It's like a mark of shame or discredit. So a mysterious mark of shame or discredit. And I want to look at the enigma or the mystery of the stigma, discredit of cannabis from a legal, a healthcare, and a personal point of view today. So first, let's look at the legal barriers or enigma of stigma. First of all, Schedule 1 status, soon to be Schedule 3. What does that mean? Not exactly sure. So that's a bit of a barrier. How are things going to change? But in the first place, it was illegal completely, and so we couldn't even address it. It's also confusing because there's 50 states with 50 different sets of laws about cannabis, and then there's the federal law, and it's different than all of those states, and they don't bind, they don't go together very well, and there's some overlap. And then there's these words: decriminalize, deschedule, reschedule, legalize. What does all that mean? So for those of us who engage and get into this, we may know this, but to others, this may be very prohibitive and mysterious. So just to be clear, we want to legalize and deschedule. We don't need a schedule for cannabis. We don't have a schedule for alcohol. We don't have a schedule for tobacco. We don't need to schedule this plant. So that's part of the legal barriers. But let's say we didn't have any legal barriers. Let's say everything was, cannabis was legal. Would that get rid of the stigma? Maybe. But let's look at 2 countries that did studies who do have legal cannabis prescribed. So the first one I want to look at is the UK. There was a study done in 2022 in the UK, and it was published in the International Journal of Environmental Research and Public Health. And they wanted to look at the perception of stigma for medical cannabis patients. And so they surveyed 450 medical cannabis patients who were receiving prescriptions from their physicians. And what they found was that 75% of them found that their friends and their family were somewhat or very supportive of their cannabis prescriptions, and they're using it as a medicine. But 38% of the healthcare professionals, they felt, were somewhat or very approving. So just over a third of the people who were literally writing the prescription for them, they felt were somewhat or very approving of this cannabis prescription they were receiving. So that's not helpful, even though it's legal. So let's look at another study that was done in Australia in 2022, and it was published in the Journal of Environmental Research and Public Health. And what they were doing was looking for barriers for women who had dysmenorrhea, and they wanted to treat them with medical cannabis, and they were looking for the barriers to that. And so they found a list of barriers. They said, well, access is going to be difficult, and location of the access, accessibility, cost. And this other thing came up was stigma. Like stigma, yes, because even though it's legal and prescribed, it has an illegal history that still exists, and this mysterious stigma still led them to have concerns about using medical cannabis, even when prescribed. So legal barriers are real. Let's look at healthcare barriers. Well, since the 1990s, we have been touting that we have evidence-based healthcare in the United States, and we do everything on research. Well, we have lack of research, lack of education, and this schedule status thing that may be changing, and whether it changes or I'm looking forward to it changing, but I don't think it'll change a lot. So let's look at the barriers of the enigma of stigma of cannabis in healthcare. First of all, there's a bit of a quandary in healthcare because we need all this research to call it evidence-based, but that research doesn't exist. But in the meantime, all these states have legal access and have medical programs, and so people are using it and people have it, and so there's a lot of state access, but yet not healthcare access and availability. So the state legalization of it is not aligned with the healthcare utilization of it at all. It's almost like we don't even talk about it in healthcare because of maybe the research. There's just not enough research, and they need to have that backup. So let's say we talk about cancer then, because cancer has been evidence-based for cannabis therapy. And so cancer certainly should be a place that we could have less stigma and more use. Well, they did a study, and it was done for cancer survivors, and it was only a small study. It was published in the Journal of Cancer Survivorship just last year in 23. So there's just 24 people, but what they did was they asked them about it, and 16 out of 24 spoke very strongly in great depth about stigma. They said it was very present as a cancer survivor with their healthcare providers, and that when compared to their professional life and their personal life versus their healthcare providers, they were much more open. They would talk to their professional, they would talk to the people they work with, they would talk to their family and friends about their cannabis use, but they were secretive. That's the word, secretive about their cannabis use with their physicians. Now, understanding that we do need evidence-based research. We don't have large-scale, long-term, double-blind placebo research on medical cannabis yet. But if anything is robust, it's cancer. So I want to also say that I have a personal story about this. I have a family member who rang the bell about 5 years ago, and she uses cannabis therapy for the side effects of all the chemotherapy she went through. And she tells, we all know about it and we all understand it and support her with that, but she does not tell her oncologist. She does not tell her OBGYN. She does not tell her primary care physician. She doesn't tell anybody that she sees that she uses cannabis. None of her healthcare workers, healthcare prescribers know that, or she doesn't admit to them, whether they know or not. It's not spoken of. Okay, so let's talk about this enigma of stigma in a personal kind of way, personal barriers. So we're nurses and we work in healthcare. And I didn't learn about cannabis, medical cannabis, or the endocannabinoid system until like 2018. I didn't even know it existed. And since then, I've been doing a lot of work and searching and understanding. And I've gone to lots of workshops and webinars and conferences, and I'm reading. So I've learned a lot more. And as I learn over the years, it's taken me a while, I begin to feel like it's less mysterious. I was afraid to talk about it at the beginning when my mother had hospice and she had that hospice nurse. But as time has gone by, I've become more confident with my knowledge of it, and I've become more willing to tell others about it and speak about it. But when I do, whoever it is, I sort of mention it and then I back off because I don't know what their reaction is going to be. I'm not sure if they're going to be angry or fearful or if they want to talk about it or anything. It's almost like a firecracker. I'll light the firecracker and put it down and then wait and see what their reaction is going to be. But I'm telling you, what's happening more recently for me personally is that the firecrackers are duds. People are so glad to talk about it. They're not blowing up with anger or fear. They're so grateful to have someone to talk to about cannabis, and they have so many questions. And so what I try to do is have conversations with people where they are and recognize that my journey is not necessarily the same as theirs. It took me a while to get to where I am. And I have to remember to think back at a time when I was fearful, when I wouldn't even speak of it, when I was triggered by it, by the topic. And so I have to recognize where people are and believe that what they're experiencing is valid for them on their journey, and bring my journey into it and sort of work together to support and educate and meet them where they are cautiously and with empathy. I want to join them in their journey. I don't want to force them into mine. Mine's not even done yet. I want to mitigate the mystery and not add to their fear. So I want to join my colleagues, and together we can be on a journey to learn more about the enigma of the stigma of cannabis. Because the opposite of enigma is clarity and truth. And the opposite of stigma is approval and esteem. And we can't go from mystery to clarity in one day or one conversation. And we can't go from disapproval to esteem, even in a week or a month or whatever. It's going to take some time. I want to conclude with a quote from nurse theorist Margaret Newman. She wrote this in the 1970s, and I think this is so prophetic. She says, "The essence of the process is in being truly present in the transformation of ourselves and others as we allow the meaning of the new reality to unfold." We must intertwine our journeys and expand our consciousnesses together. And only then will we solve the mystery of the enigma and slowly change the stigma to clarity, truth, approval, and esteem for medical cannabis in healthcare.